Hi, I'm Kim. I'm currently living in Germany and I'm studying medicine right now. So I learned about the Global Health Next Generation Network while I was still at my master's in Global Health in Barcelona. So there, Elena Marbain, she was introducing the network and I was like, wow, this is amazing. So young people from all over the world come together and they're all passionate about global health and you can learn from each other. So I thought, okay, I really need to join this network, and not only join the network as a passive member, just kind of benefiting from it, but I actually want to give also some like a part of me inside. I wanted to be part of this network and really form this network. Right, so right now I'm studying, as I said, I'm studying medicine in Germany, and alongside my studies I'm working as a student assistant in the Charité in Berlin, and there I'm in the working group of Global Digital Health, and I'm, as I said, working a lot in global digital health. So basically I'm doing research, and we're also currently implementing a project on reduction of financial barriers and improving health facilities, like the quality of health facilities in Madagascar. Right, so my career path is, usually when I tell people about my career path, they're like, okay, what? You did this, then you did this, and now you're doing this. But actually it all fits together, and I really like how it like complements each other. So after high school, I did a bachelor in industrial engineering and management. And then while doing this bachelor, I noticed that it was really nice, but it was not the passion that I had. So when I talked about it, I could talk about it, but I wasn't like, this is amazing, this is cool. And then I decided, okay, I really want to follow my passion. I want to find my passion. I want to work in something that I feel like, yes, it's worth it to work for. So after my bachelor in industrial engineering and management, I started studying medicine in Germany. And well, that was mainly motivated because of my interest in the human body, and I'm doing a lot of swimming. So in swimming, I got really interested in the human body because I wanted to know how do people improve, etc. So I went to study medicine, and that was also very interesting. But same story kind of here as well. No, it's like, it was cool, but the spark was missing. And that one day, I went to a really, really good seminar. It was just a 2-day seminar about global health. And I really fell in love with the subject. I was like, oh my God, this is it. This is what I want to do for my life. And then I decided, okay, I'm just gonna start studying a master in global health. And it was a 1-year master, as I said, in Barcelona. And yeah, so then I really found that everything else that I did before, it complemented the global health. So in industrial engineering and management, I learned a lot about informatics, economics, everything from that part, also like project management, for example. And then in medicine, I obviously learned about the medical part of it. And now in global health, everything comes together, and that's amazing. So I did my master in global health, and afterwards, or right now, I'm finishing my medical degree. So my secret when it comes to applications is to, first of all, really understand what is my own motivation, and not only my motivation to, okay, I want to earn money, no, but like, what is my motivation behind it? Like, why do I want to do it? I think what you need to understand is your long-term goal. Is this job that you're applying to really the job that brings you to your long-term goal? And then also is, would you be happy in that position? Like, if your first question is answered yes, and it really serves your long-term goal, then also the second question should be answered yes, right? Because it doesn't really make sense to be working in an environment where you don't feel happy or you don't feel comfortable. So I think, first of all, you need to answer those 2 questions, like, does it serve my long-term goal, and would I be happy working there? And then once you have answered those with a yes, then I think it's much easier to answer the question, or to be like, okay, how can I write the motivation letter? Because you have your long-term goal in mind, and you know why you want to do that. So you know your motivation. The only thing that you then need to find out is, what can you bring to the company? So what are the skills that you already have that are different from other people, or that will bring a benefit to the company? I think this is my secret to applications. Yeah, so how do my current studies help me in pursuing my career goals? So basically, maybe to start with, what my ultimate career goal would be is, in a couple of years, maybe 10, 20 years, I envision myself as a professor at university, because I'm really passionate about education. I think education is the key to basically everything. So I would love to be a professor at university doing meaningful research. And as said, like, all the studies that I did right now, they complement each other and they're really important. And I think this is why I'm doing them, and this is why I think they are so really important. Now I'm learning in medicine, I'm learning the fundamentals of the human body, and in the other things I've learned about the rest. So it complements each other, and I think it serves the long-term goal. And then also kind of working while I'm studying, it really helps me to earn a lot of experience, and also on the ground experience in research that I then can use for pursuing my dream to become a professor in university. So as already said, I love swimming, and I'm really into swimming. It has been my passion since I'm 6, and it's just amazing. So I love it, to the feeling that you train in a team, and then your team kind of becomes your family. And so I'm really, really into swimming, and lately also a lot into yoga. So I think sports is really my passion apart from global health. And then obviously it's also, so I've been living in quite a lot of different countries, and that's also something that I really enjoy, not just traveling, but I enjoy staying in a country, getting to know the culture, getting to know the language, and actually being able to integrate and understand how different cultures are built, how different societies are built, and eventually form part of that. And yeah, so that's what I really love. So for me, global health means, within the definition of global health, of achieving health equity and improving health for everybody in the whole world, it means a room to be myself, focus on the projects that I really love, that bring the world forward, that bring me forward, that helps the patients, that help the health system, that helps the countries to have a good health for everyone. So it's something that is very it's a super open field, global health, and that's what I love, because it gives everybody the opportunity to act within and make their own projects that help to improve the health for everybody. Yeah, so basically I think I briefly touched on that already. So for example, the project in Madagascar, per se, we're trying to reduce financial obstacles and improve the quality of the health facilities there. But I also think that research is very important, because based on the findings of research, you can actually improve a lot of different things, be it in digital things, be it in rapid test diagnostics, be it in antimicrobial resistance, etc. So there are a lot of different things that you can improve through research. And then, as I said, I really love teaching, and so for example, I also was invited to teach at a seminar, or at various seminars at IS Global in the master program. So I think that is also very important, not only to do your thing right now, but to also be able to educate the next generation of professionals and give them a passion and a purpose. What I would say to a student that wants to work in global health, I would say go for it. Really, it's an amazing field that is so broad, and you can bring in your own ideas, your own projects, everything. So I really encourage everybody to go for it. And as I said, it's like it's really broad. If you're into research, you can do it. If you're into implementing of projects, you can do it. If you're really on, like, you want to do on the ground work as a doctor or as a medical student, like, you can do it as well. Or you can go to the WHO, you can work in policy, you can, with this field, you can do anything, and that's amazing. So really go for it if you feel that this field attracts you. Right now, if I could go anywhere, I'd like to go to Nepal. And please don't ask me why. I've got no idea why. It's just ever since, I think 3-4 years ago, I was like, I'd like to go to Nepal, but I don't know why. So that would be a country that I would like to go to.